Welcome to the Dr. Geo Prostate Podcast. Today's guest is Dr. Paul Anderson, one of the world's leading voices in integrative oncology. With over 30 years of clinical experience, leadership in NIH-funded cancer research, and a career spent training doctors worldwide, Dr. Anderson has seen firsthand how intravenous IV vitamin C can complement conventional cancer therapies. He's also the founder of ConsultDocAA.com and the AAMP medical conferences, where he educates healthcare professionals on the latest science in integrative medicine. In this episode, we explore whether high-dose vitamin C really plays a role in cancer treatment, even for men with prostate cancer. You'll learn how IV vitamin C works differently than the supplement you take at home, what the research actually says, and which patients may benefit most. Let's get into it.
Before I proceed, I just want to clarify that this podcast and all Dr. Geo content is separate from my faculty position at NYU Langone Health. The views and opinions on this podcast are my own. Our guests and sponsors are curated by me and not affiliated with NYU Langone Health. Sponsors are a way for us to provide high quality information at no cost to you so that you can take better charge of your prostate health, testosterone, and erectile function, and also how to live better with age. Welcome to the Dr. Geo Prostate Podcast. I'm your host, Dr. Geo, where it is my intention to help you optimize your prostate health, even your overall health, prostate cancer, despite having it. How can you thrive with it, despite of it? And what else is there? What are the type of things that will help you and empower you to take action and to create a microenvironment, right? That's hostile to cancer cells. Well, now today I have one of the best naturopathic doctors in the game. His name is Dr. Paul Anderson. You heard a little bit about him in the intro, and it's such a pleasure to have Paul here on the podcast. Paul, thank you so much, my brother, for being on.
Thanks for having me.
Paul, it's hard to schedule you and to find something to talk about. And it's not because we don't have a lack of things to talk about. It's because we have so many things we can talk about. And it's like, do we go into, a general discussion on all the alternative and out of the box type of things that's out there? Or do we go into one specific? And if we go into one specific, you know so much, we can go into any. So I decided, all right, one of the most common questions I get asked is about vitamin C, and particularly intravenous vitamin C and cancer. And then, of course, prostate cancer, which is what I specialize in. So why don't we focus on that? And if we kind of go in a different direction and, it's completely fine, but we'll focus on that for now. Does that sound good?
Sounds great. Yeah.
I think people misunderstand still what's the difference between taking oral vitamin C and intravenous vitamin C. And they do two different things. So physiologically, do you mind expanding on that and what's the difference between the two?
That's a perfect place to start, actually. So because there's such a difference in the absorption and the ability to get vitamin C in your blood between taking it by mouth and taking it intravenously, it's by orders of magnitude. It's a huge amount of difference. Whenever you have that much difference with any biologically active substance and even some drugs also, you can have two totally different physiologic or biochemical effects from those two dose differences. So for example, if you take oral vitamin C, most people have maybe taken a little too much and got diarrhea or some stomach upset or something. Your digestive tract, depending on your level of health, is only going to absorb a few hundred to a few thousand milligrams a day, unless you're really pushing it.
Could I ask you to pause there for a second? Because I think that's actually important.
Yeah.
You have people that take 2,000 milligrams of vitamin C. And this is when people say, well, that's just expensive urine. They might be right in that particular circumstance because the absorption of those 2,000 milligrams might be anywhere between 500 and 1,000 or so, depending on many things. So can you expand on that particular scenario a little bit? Because
Yeah,
when I recommend it, it depends on the case. But it depends,
right.
because if we're, depending on what we're trying to do, they have to take it 3 or 4 times a day to get absorption. So once you get, we'll go ahead and expand on that.
Yeah, I think that is a good place to start with oral. Everybody's absorption is somewhat different. And there's actually more modern studies showing that some people absorb more than a few thousand milligrams. But if you look at the average human, um, the things you can do to increase absorption within the range of your max. First thing is divide the doses. Don't take all of it at one time, because then the receptors aren't bombarded all at once. And then the next is to start smaller and work your way up. And what I tell patients is your body will let you know when it's done absorbing, because it will stay in your digestive system and draw water towards the vitamin C, and you'll get loose stools or diarrhea. If you hit that, you might as well just not take that dose, back off. The other side of it, though, is people, if they are recovering from, a surgery or an illness, or if they're starting to get sick with, especially with a virus, their absorption before they hit loose stools way up, because your body's actually preferentially pulling the vitamin C in. So I always tell people, listen to your body first, because vitamins, other things not so easy, but vitamin C is pretty easy to know when you're not absorbing anymore. And that's when your stools get loose. So I'll have people take it 3, 4 times a day if we're trying to get the level up. But the average human adult, it's going to be, maybe 1 to 2 to 3,000 milligrams max absorption a day, even if you do spread it out. A little more when you're sick, a little more when you're under stress recovering. The other side of it, though, for the oral side of the equation is, people may not know, but humans don't make their own vitamin C. We're one of the few that doesn't, actually. And when we're under stress, our natural vitamin C levels drop sometimes to 0. This was one of the big problems during acute COVID, for example, and other stuff. Body gets under stress and it uses the vitamin C that you did have around, and it's water soluble, so it's just gone. So the only vitamin C we get is what we eat or take as a supplement. So this is another reason why when you're under stress, your absorption will go up too. So yeah, definitely the oral is great. It helps keep you kind of satisfied, the body biologically, with your vitamin C for redox and all the good things. But that is sort of like a whole different world from putting it into your venous system.
Just to hang on oral for a second here, evolutionarily, why is it that we don't make it? So some would argue that if we don't make it and other animals do, might mean that we don't need it, which is not true. So what, any idea why that is, that most animals make it and we don't?
Not being an evolutionary biologist, I'm not sure if anyone's ever tried to answer that question, other than the things you commonly read are, we as a, higher order animal have more ability to choose the foods that we're eating, and maybe more variety, et cetera, to get foods that might have more vitamin C in them. But it's actually not a deletion, but a sort of a block in just one. There's one enzyme missing between us and, say, a deer in making vitamin C. And so the theories are, that's maybe why. Problem is, it's not deleted because we don't need it. That's sort of, who knows why that happened, but it happened. And so when you think about it, vitamin C, one of the reasons it's so critical is all of our cell processes that protect our cells use 3 things at the base to keep free radicals neutralized and that sort of thing. They use glutathione, which our body does make, mostly in our liver, vitamin C, which we don't make, and then vitamin E for fat membranes, like cholesterol and your cell membranes, things like that. Most of the vitamin E you get from food also. But the only one that is taxed like immediately is vitamin C when we're under stress of any kind. And so, yeah, for whatever reason, we lost that ability. The other thing is, animals that still have those enzymes will literally make more vitamin C when they're under stress or when they're sick. So there's, the whole rest of the animal kingdom gives itself internal vitamin C when it's under stress or sick. And we have to kind of do it, the old fashioned way and eat it.
Understood. One more question with regards to oral vitamin C. There's a lot of different types in the supplement world, right? I'm a bit old school. I'm just like ascorbic acid, and that's it, right? Am I missing something? It seems absorbable. It seems to do what it's supposed to. Is the one the type that's been most studied. So maybe you could break down all the different kinds that are out there, and does it make a difference?
I think, so kind of go in reverse order. What I normally tell patients is ascorbic acid is very easy to absorb. It's the simplest form of vitamin C. And so if it doesn't bother your stomach, which some people don't tolerate it as well, but if it doesn't give you burning stomach or something, just use that because it's the easiest, it's the cheapest, and it's very easy to do. When we have people who are under a lot of stress, they'll get powdered ascorbic acid and put it in juice or something. If a person has GI sensitivity, some people do, to plain acids, I will do one of two things. Either I will do a buffered vitamin C, which is usually some calcium, magnesium buffered to the vitamin C, so it digests a little easier, or another form, which is called ester C, which has esterified in. So it's a little easier for the stomach to take. And people with gastritis and ulcers, sometimes that makes a difference. If you look at the absorption data across all the other forms, so there's some other sort of fat solubilized like liposomal vitamin C and some other cool things, most of the time they will absorb. They might absorb a little better, but for the cost, they're really, they're not worthwhile for most people. There's some people, but, they're not that important. Now, obviously, I don't work for any of those companies, so it's
a lot of good marketing around that. I'll tell you that much.
Yeah, there really is. And, liposomal for other things can be very important because it's harder to absorb. Vitamin C largely travels in the same transporters and receptors as sugar. So it's a similar ring structure to glucose. It's not the same, but similar. And so it kind of tumbles in right along with the way we would absorb carbohydrates like sugar. So it's not like it's a very elaborate thing that we have to, do to absorb it. So yeah, I tend to just have people do the simplest and cheapest, which is ascorbic acid. And then if they get a little stomach burning or something, we don't want that. So then a buffered ascorbate or ester C works.
Since chemically it looks very similar to sugar, does it raise blood sugar and then by default raise insulin or no?
Yeah, the short answer is no. There's a little confusion around it though, because ascorbic acid, if you're using like a glucometer or most of the CGMs that you might have on your arm, most of glucometers and many CGMs can't tell the difference between the ring that's ascorbate and the ring that's glucose. And normally we have vitamin C that we've absorbed, but it's not a very high amount, so it's negligible on a glucometer. If you look at the cautions for your glucometers, especially, it's when you get to thousands of milligrams, and certainly any IV, your glucometer is going to read a high glucose number, but it's not really glucose. It's glucose plus all that vitamin C. So you do have to be a little careful about that. So no, the fact that it goes through glucose transporters and likes to activate them doesn't really shift. It doesn't really trigger a lot of insulin formation, for example, or other things like that.
Great. And my last question as it relates to oral, what's the value of taking oral vitamin C? Let's just say in patients with cancer. It might depend on the type of cancer and the stage of cancer, but I'm wondering if there's a kind of a general approach as it relates to these two, vitamin C and cancer, and the value of it.
Yeah, I think if you take a step back from the macro, somebody with any cancer, the amount you're going to take orally is going to mostly satisfy that water-soluble antioxidant compartment that we talked about. There will be people who will have theoretical concerns that, antioxidants are, bad for your chemo, or they might make your cancer come back or something. You can't take enough oral vitamin C to do that
Or
sort of thing.
radiation, right? That's
Yeah. It's like that's just not
yeah.
going to happen. Now, if you ask almost any radiation oncologist, they'll say, "Well, don't even look at
I
vitamin
know.
C."
I take them off
But you do,
too, just to kind of not confuse
yeah,
the patient, and then we do other things that might work even more synergistically with radiation.
yeah,
But I take them off just so that
yeah.
there's not a lot of back and forth.
Yeah, it makes everyone's life easier, and it's not that long. So no, I think generally speaking, if we're thinking about, okay, what other than the big focused either tumor killing or shrinking type of treatments that we're doing, what keeps me alive the longest, regardless of what cancer I have? Well, it's the tumor microenvironment.
Right.
And if the tumor microenvironment stays calm and we don't get a lot of recruiting for new cancer cells, or even, unfortunately, conversion to cancer cells in the microenvironment, I live longer, regardless of
Yeah.
my cancer. There's a million things that affect the microenvironment, but one of them is just simply balance in this oxidative reductive environment. So normal levels of glutathione, not super high, but normal vitamin C levels, normal vitamin E and other stuff like that. So I just tell people, look, you're not going for this overwhelming amount of vitamin C, but you want to keep it going in, because beyond all your other treatments, your tumor microenvironment, we want to keep kind of asleep. We want it to be very calm. And if you get really constantly oxidized, so you run out of antioxidants, that's not good for the tumor microenvironment. It pushes a ledger towards cancer. Now, we might do therapies that oxidize the patient, but you don't do those every single day all the time. So I think it's an important thing. It's very safe. Your body already uses it. And orally, you kind of have a natural, governor on the system where you're not going to overabsorb it
Yeah, it's pretty
regardless.
impossible between the kidneys getting rid of it
Yeah.
and or your digestive system.
Yeah.
Cool. Any toxicity as it relates to oral vitamin C in any patient, any person, and in cancer? For example, we know that it helps with the absorption of iron, right? That's not a bad issue unless the person has hemochromatosis. Then we want to modify that. Can you talk on that
Right.
a little bit?
Yeah. If somebody, a couple of things, generally speaking, unless you have an allergy to the base of whatever the vitamin C was made from, there's not a lot of toxicity because our body's set
Right.
up to absorb it from food, etc. There are adverse effects such as diarrhea or upset stomach and gas and bloating, but those are more chemical issues. Those aren't really
Which resolves
toxicity.
itself once you discontinue.
When you stop taking it, yeah, or take less. So generally speaking, orally you can't get toxic. You could get diarrhea or something like that. There are people, some vitamin C, some ascorbic acid is made from different sources. And if they have sensitivity to the source, you get the patient who says, every time I take vitamin C, these things happen. Sometimes they just have to get a source that's not whatever. So there's a lot of corn based that some people react to, for example. So no, there's not really a lot of toxicity. It's extremely safe as long as you keep track of your GI system. And you don't really need a whole lot of elaborate forms of the vitamin C either, just to kind of keep everything working.
Do you make changes when they have hemochromatosis, which is it's too much absorption of iron, and then that could be toxic? Any changes there, or do you discontinue?
So this will happen a lot. You go to any doctor and they prescribe iron because you're anemic. On the label, it'll say, take this with the vitamins, orange juice or something like that. That's because the vitamin C, most iron that we take in is a non-heme iron, like ferrous sulfate, something like that, is stimulated to be absorbed onto transferrin by vitamin C. So what I have people do if they have hemochromatosis where they do too much of that is to take the vitamin C away from food that may have any iron in it. Now, if you're taking oral vitamin C and because it's water soluble and you don't have any iron containing food, you're not going to absorb more 10 hours later, you know. So let's say they have a breakfast that's pretty much, there's no extra iron in their breakfast. They take their vitamin C. And then at lunch, they have something that might have iron in it. The vitamin C is not going to magically go to their lunch and make them absorb more. So it's literally about being in the digestive system at the same time as the iron containing food. But, you know, most people with hemochromatosis are coached to eat pretty low iron residue diets. I mean, as much as you can, certainly. Yeah. So it's really less of an issue there. When we flip over and talk about IV vitamin C, there's a little unique thing with hemochromatosis that fits into.
We're building up the stage. We're building up the stage.
Right.
I was going to segue into oral. As it relates to oral vitamin C, which I take daily, there's many benefits from antioxidant element to it, collagen formation, right? So anything, all the proteins that build collagen for our skin and other tissues, for dopamine, production of dopamine, which is our feel good. If you don't have enough vitamin C, it's hard to make your body make dopamine. Any other benefits as it relates to just general well-being and or cancer?
Prolon is the only nutrition program patented to support longevity, health span, and protect lean body mass through cellular rejuvenation. This 5-day fasting mimicking diet keeps your body in a fasting state while allowing you to eat nourishing foods. Over 5 days, your body is rejuvenated at the cellular level, supporting fat loss with muscle protection, boosting energy and mental clarity, and giving you a complete body reset. Your kit includes everything you need for the full 5-day transformation. Click the link in the description to learn more and see our partner pricing.
Yeah, I think so. Those are all really core functions of vitamin C. It's also involved in, beyond dopamine, it's involved in a lot of our neurotransmitters, both the peripheral and the brain central ones, in a lot of the, you could call it regulatory pathways. So with neurotransmitters, whether they're running your gut or any other part, there's a production end, and sometimes like in dopamine, vitamin C gets involved in that. But then there's also the metabolism end. So we have the right amount. We don't get too much or too little. Vitamin C is involved in a fair number of the metabolism steps for our good brain chemistry and other things like our gut. Additionally, and this is where, so you think of like this antioxidant effect is very global. It's everywhere in your body. The other thing that it's helpful with is supporting a little bit of the phase 1 liver detox and a little more of phase 2 liver detox, and helping to keep that balanced. And one of the things I think, especially with a cancer patient, but any of us to stay healthy, we live in a world that chemically 100 years ago didn't exist. We're exposed to chemicals that we can't see all the time in the air and the water and the food and everything that didn't exist 100 years ago. And our body has these nice ways of trying to eliminate them, but they're more taxed than to be. So one of the things that happens is that as our body tries to do its job, it will get a little behind in the detoxifying, especially with chemicals. And vitamin C, because it's water soluble, is one of the first things to go. So in addition to just being a general antioxidant, helping with our nervous system and stuff, the less behind our detoxification pathways get, the less stress there is on our epigenome and triggering cancer cells or, inhibiting cancer protection, stuff like that. I think a good baseline, it's hard to keep up because of modern toxicity, et cetera. And
great point.
It's it's sort of like drinking as clean a water as you can get and moving your body. It's just a baseline thing that's going to help.
I'm glad you've made that point of the benefits of vitamin C in a detoxification pathway. So a lot of patients are, you look on the internet, the news, all these environmental toxins, and there are. That's a big part of what we learned in naturopathic school. But there's only so many changes, and some of these things you have no idea where it's coming from. So it's impossible not to have exposure to environmental toxins. What we can do, however, is optimize your ability to detoxify from these toxins. And so that's a big part of the program is, okay, here are the main things to limit exposure, but let's build your body so that your body does what it's supposed to do and not to stay in and cause problems. I really believe that building the body, I think I'm preaching to the choir, building the body up so that it's optimal in a cancer patient, and detoxification, and Patrick Song now it's all over the place from Doug Carlson podcast in terms of the importance of the immune system that is undermined in the world of oncology. How can you fight? How can your body fight when you have a depressed immune system, or depressed, more specifically, lymphocytes, neutrophil to lymphocyte ratio? That's no one looks at that. I mean, only I think people in our world. No one looks at these ratios. Well, are we following the data? Are we science-based, or aren't we? If we are, it's very clear that's an important biomarker ratio. So I think that things like vitamin C and a few other things that we use for detox, liver health are crucial in patients with any cancer, certainly prostate cancer. So I thank you for detailing that and expanding on that. All right. So now let's go to it. Let's go right to it. IV vitamin C. So that's a whole different beast in comparison to oral, isn't it?
Yeah, it's depending on the dose that you put in. But the first thing, which is sort of self-evident if you just look at it, if I take oral and I have this limit before I get diarrhea or something of what I can absorb, if I put it into a vein, there's no effect because it's going right into your blood. So that means instead of 1,000 or 2,000 milligrams, I can put 5, 10, 20, 100,000 milligrams, 100 grams into your blood. And so then you have to say, well, wait a minute, that's a whole different chemistry when I have that much vitamin C in the blood. And the big difference is, and this of course is relative to dose, but the big difference is that, yes, it's still vitamin C, but when we get the levels up high enough, the elimination slows down temporarily. The plasma, the acellular part of your blood, keeps a lot of vitamin C in it. And so then it can go to cells and cause a redox cycle like a Fenton reaction and actually create some peroxide at the level of the cells. Now, the reason this becomes an important thing, say in cancer at higher doses, is that becomes very hard for some cancers to essentially deal with. Peroxide, we make it all the time, but our normal cells have catalase and other enzymes to turn it into water, basically.
How does peroxide that we make in the body compare to like hydrogen peroxide? I think that's a question that people have had.
It's the same thing, actually. It's a natural byproduct of just breathing and living every day. But when you force the formation of it to be the same as the stuff that bubbles up on your cut, when you force the formation of more of it, it becomes an irritant to the cells. So what I'll often tell patients is, let's say, for the sake of example, I have a normal cell and right next to it I have a cancer cell. The normal cell has regular amount of catalase and other stuff. So the peroxide goes there and it just gets turned into water, some remnants. And then that normal cell will use the vitamin C as an antioxidant to cell support. The cancer cell, many of them don't have a lot of catalase or any catalase. And so the peroxide will injure them. And it's not that it's like blowing the cancer cell up or something. What's happening is the injury then calls the immune system to come and look at it, which is one of the big problems in cancer, is the cells get blinded to the immune system. So we were just talking, for example, about leukocytes and natural killer cells, all those guys. If they don't know the cancer's there, if they're not looking, they won't do anything, especially natural killer cells. So if we bother the tumor cell with a peroxide burst, the natural killer cells and the other surveillance cells in the immune system are more likely to say, oh, that should be there, and start something. And then there's a secondary effect when I give somebody a high dose of vitamin C that we often don't talk about because it's sort of like we're focused on this peroxide surge and all, which is the cool part. But the rest of your body then will, depending on how much vitamin C you give the person, will take the next 12 to 36 hours. And any cells that need vitamin C will just soak it up. And it's actually good for the normal cells. So the reason, the name brand number one reason in cancer it's used is to high dose would create this peroxide surge. get the immune system to look at these cancer cells and maybe attack them. Then there's these other side benefits for the normal tissue. So as opposed to like a chemotherapy where it's going to affect your normal tissue and your tumor both bad, vitamin C affects the tumor hopefully in a negative way, but your normal cells just use it for support. And then there's other things actually that creation of the peroxide and the high dose vitamin C do that are also supportive to your anti-cancer immunity. And there's a number of, we call them sort of footnote things, but they're probably quite important, like normalizing your NAD pathways, which in cancer can upregulate the wrong way and feed cancer. And there's a number of other sort of not as well known, not as, sexy as the peroxide formation that go on with high dose vitamin C.
Interesting. So the peroxide that it forms, it attracts the immune cells. It's not that the peroxide itself is damaging or killing the cancer cell, is what it does by default, which is attract immune cells to come and take care of those cancer cells, correct?
Yeah, it's going to injure a tumor cell to one degree or another. And the hope then is, whether it's a peripheral or hopefully an internal injury, it's not that the cancer cell maybe is going to die from that, but it's going to have an immune reaction to it that then gets your immune system to say, oh, this is a cell, we should do something with that. Here's one of the problems when doctors or patients read research about peroxide in cancer, they'll do research, and if you take any tumor cells and you put them in a petri dish and you give them peroxide, they will blow up and they'll die, right? Well, you're not a petri dish. You can't make enough peroxide to have that happen. So the goal is we want to beat up the cancer cells. Now, if we get a couple that die, that's great. But it's more that we're beating the cancer cells up. And so there's that. And then in your world with prostate cancer, although this is universal, but I think prostate cancer, we see more data about it. Advanced prostate cancers, in my personal experience, often have a lot more toxic exposure and sort of overwhelmed detox systems. I know, the only prostate cancer patients I've ever gotten referred are very advanced ones. Everyone else keeps the easy, low ones. And more often than not, they're in professions that were just decades exposed to solvents or other chemicals, things like that. And it's not that maybe that caused it, but it sets their body up so that once the cancer starts, it's a whole other stress, right? Well, one of the things that vitamin C is, it actually, even in these high doses, separate from the tumor effect, your liver will really use a lot of the vitamin C, especially early on, and help, as we talked about earlier, to run the detox pathways maybe a little bit more efficiently. And if toxicity is a bigger piece of the pie with your cancer, it's just a side benefit that can be helpful.
How much research, you spoke about some data as it relates to prostate cancer. I've seen some, it seems like the data around IV vitamin C and cancer is on other cancers, kidney cancer, for example. There's more on that, perhaps breast cancer. Is there a difference? For example, if somebody's going to go get IV vitamin C for advanced prostate cancer, is that different than if they were getting it for any other type of cancer?
In one sense, yes. Many types of cancers respond differently to vitamin C IV. And you're right, the focus of a lot of the research is your big name brand solid tumors, breast, a little bit of colon, kidney, and pancreatic, et cetera. And now we're getting more where they're doing it alongside chemo, and those actually turn out well. So with prostate cancer, the things I'll usually tell patients up front is it's biologically probably a little bit different than, say, if you had pancreatic cancer or colon cancer. But also there's some mechanical things with prostate cancer and high-dose vitamin C that we need to tell the patient so that they tell us if they're happening. One of them is that if you think about it, so I'm not going through the oral route now, I'm putting it in your vein, and I'm putting 50 grams, 50,000 milligrams or 100,000 milligrams in a one IV. that increases the solids, essentially the particle in your bloodstream temporarily, which is fine. That helps it get into the cells and all that. But it can create what we all like to call osmotic shifts. And if you still have a prostate, the prostate, because of the capsule, is limited in how much it can flux and swelling and shrinking and stuff. So, and this is not universal, but some men, we will have to be careful with the dose because they'll get a lot of urinary urgency.
Right.
Because the prostate's, I mean, you think about it therapeutically, it's great because it's going to the prostate, but it causes this shift of water in, from the extracellular component. And then the prostate can only swell so much. So we do warn them. That's not universal, but I've had enough guys that that's one thing I'll warn them about. And so what I'll tell them is, well, if it happened at 75 grams, but not 50, or at 50, but not 25, then we'll just go gentle and work your dose up to your comfort, really. So that's one thing. The other thing, and this is a little bit of a laboratory artifact, but because of the way PSA works, as I'm sure your listeners hear lots about, initially, if you're doing something like this, and especially where the prostate may sequester vitamin C and you get this immune literal fight going on, the PSA often, especially in the first 12 weeks of high-dose vitamin C, may rise because you're getting this treatment effect. The prostate's much more active immunologically, so then whichever flavor of PSA you're doing will often rise. And one of the things that you almost have to have a conversation that includes the patient and their family, but also their urologist too, because everyone will look and everyone says, oh, a PSA rise equals worse disease. And what I can tell you, although this is something I was involved in human cancer research and we never got to publish this, but I would love to live long enough to do this. In almost every case where we had a secondary measurement, so we could do an interval PET scan or something and look at disease, actual disease, that's not what was going on. The PSA was rising because of immunity in the prostate or in the cancer tissue. But you do have to be aware of that, because if your whole prostate cancer journey, you've heard if the PSA is going up, that's always bad. And then we got this one thing that might give you a pseudo elevation, but we don't tell you about that. All you think is, oh my, the vitamin C is driving this up. So, but like I say, what makes me comfortable to talk to patients about it is every time we've done any other investigation, like a PET scan or something like that, it's not the disease that's active. It's the immune system and the prostate tissue.
That would still make them nervous. It's nothing that provokes more anxiety in men than elevating PSA, I tell you.
Oh, yeah. Yeah. Oh, 100% of the time. It's better if you warn them, but it doesn't make the anxiety.
I wonder if dosage matters. So maybe it's not 75, maybe it's not 50, maybe it's 25. And that wouldn't cause such a strong response, though you want that response, but not such a strong response, but it's therapeutic enough in a situation. So it's kind of, that would be a nice trial, right? To try these things and try the different dosages and dosage escalation type of study.
And I kind of think that's why there's not as much data on prostate cancer, because in people who do high dose vitamin C, there's sort of this knowledge or folklore that might make the PSA go up and they kind of avoid it. But also there's a lot of specifics and looking at, does dose make a difference? But also, can we have non-PSA imaging or other markers that could look at disease state and tell us, no, actually the disease is not what's happening.
I think we're almost there, if not there already, between the technology that's available. There are two primarily, which is as sophisticated as they've ever been, which is a 3T MRI, and then you have the PSMA PET scan. So that combination, and then soon enough, you'll apply some AI to that to give you some more information and better information. I think that if not now, it'll be there. It'll be there soon. But then, that should be interesting. So how about in men? So many men with advanced prostate cancer don't have a prostate, right? So they had it removed, but the cancer came back. And now, what's the approach? Is it definitely higher dosage of IV vitamin C? And what can one expect in that situation?
Right. So in people where there's no more prostate, usually the mechanical issue around urinary urgency is not an issue unless there's a lot of scarring or something that gets aggravated. The PSA issue can be a thing where the PSA rises depending on how much residual there is and what the PSA is doing. So I always warn people about that. I would say the majority of people that I've seen over all these years are post prostatectomy. And high dose vitamin C generally is still a use. It's not, you don't want to drive the cancer treatment truck with one thing ever, obviously, but as a base to support your immune system and make the immune system more likely to go after the cells wherever they are, it's a really good utility treatment for that purpose. So in advanced post-prostatectomy patients, in addition to the other things we might do, say with botanicals and lifestyle things, all the things, vitamin C is still, I think, a very worthwhile thing. Now, if somebody has already done it and they've got maybe a very aggressive form, we would often move on and do something different, because vitamin C is, it's like in baseball, a utility player, like can do almost anything to be helpful, but it only does what it does. When it's not working, my experience has been that let's do something else. Let's spend your time and energy and money in a different way. And there are many other things to do. But I think as a base, it's the most commonly thought of because it's the thing most people have. And so if you can, and it's the easiest, not easiest, it's the most likely thing to find if you're going to integrative doctor's clinic or something like that, because most of them that do IVs do high dose vitamin C. So yeah, I think it's still very useful. But one of the things we did learn in the human research, which we observed anecdotally, but when we started keeping track, if the disease was not modifying in some way, and every cancer is different, by about 20 IV vitamin Cs, so enough to tell, it was, except for maybe as a support item, if the disease was still progressive or not modifying the way we wanted, 20 is about the time I would say, okay, we've given this a good try. We're going to move on to do other treatments. And what we found numerically was if we did less than about 10, you can't tell effect. You get between 10 and 20, you can kind of say we're on the right track or we're not. So I always tell people up front, don't just do one or two, as long as you tolerate it. Plan to do about 20, ideally 10 weeks of twice a week is great as your first go. And then we'll make some educated looks into your disease state. After that, it's kind of like, let's not hope it's going to work after 20. If it's not working, let's move on to something else.
So the intervals are typically about twice a week in the beginning.
Yeah. And that's, again, borne out by numbers, but also kind of a clinical determination. In the, over 25 years ago, let's say, what we thought was, oh God, if we could do vitamin C 7 days a week, it would be even better for cancer, right? And people did that. They tried it, and it actually doesn't do any better to do it that often. So 2 or 3 times a week in the beginning. And like I say, we get to 20, and if we are, let's say the disease is stabilizing or regressing, which I've seen, then we usually go to once a week. And we do that for usually 2 months. As long as the disease is still doing the right thing, then a patient might say, do I have to do it every week forever? And the answer is probably not, but we'll let your body tell us. So instead of going to none, which we've seen people do, and then you get disease, coming back, if it's actually working, after a couple months at once a week, we'll do every other week for a couple months. Still stable, we'll go out further. What we found with we call them our super responders. These are people that a lot of times they were too old for chemo, or There are other reasons. They're too aggressive. The people that responded well and their disease stabilized, or they had what you'd kind of consider paralyzed tumors. So the tumors were there on imaging, but totally non-active. We generally would get them around every 5 to 6 weeks. And if we went further than that, they would start to have some symptoms come back. So maintenance usually is about once a month or once every 6 weeks, something like that. Again, and so there's only two pathways I see. One is you get to 20 and disease is just still steamrolling along. Let's do other things. You get out there to 20 or so and things were winning in whatever parameter. Then, yeah, let's go to once a week and see if we keep winning, and then a little bit less. And then the other things you're doing have time to kick in.
Do you find that IV vitamin C works well with something else, anything else in synergy? For example, you made it very clear that the peroxide benefit of it is attracting immune cells. So immune therapy with IV vitamin C, it sounds like there's synergy there. Do you find that there's synergy between IV vitamin C, immune therapy, or anything else?
Yeah, if you have my experience has been, if you have a non-cellular immunotherapy that is working, so you've got some targeted drug treatment, et cetera. IV vitamin C is very synergistic with those because, again, it just raises the immune surveillance. It allows the immune cells to do more of their job. And then if we have any one of the types of targeted therapies, they're more likely to work in that background. So it's not so much maybe they're hitting the same place, but one allows the other to work more smoothly. And this is a little bit newer, but in a hospital that I work with in research, they have been doing autologous immunotherapy, so using your own cells, where they take a class of cell, whether it's a dendritic class or natural killers or whatever is going to probably work the best. And they have a cell enrichment lab where they train your cells then to attack the tumor. So they have a biopsy of the tumor with its markers, and it's your tumor. Then they have your natural killer cells and they grow both. And then they train your natural killers or your dendritic cells, or there's a couple other classes too. And they train them specifically for your tumor markers, essentially. And all of ours can be different sometimes. That type of immunotherapy has an extreme potential upside to it. It's very obviously, this originally had to be done in collaboration with a university's immunology department just to get the cell enrichment right. It's very tough. But what happens then is you put those back in. Depending on the cell type, they might put them into a node, or they might, put them wherever they're supposed to go. Vitamin C, in part of the support therapies we do with that, the patients will get usually 2 or 3 IV vitamin Cs during the week while they're in as a synergist to help the background, help their body deal with the autologous immunotherapy. That's actually, that particular project is not in this country, but there are more, there's more phase 1 and 2 trials going on in this country with autologous immunotherapies. And vitamin C is, if you think about it, let's say you're not taking your cells out and putting them back in and doing all that. What you're doing with vitamin C, part of the goal is that your own natural killer cells that haven't been trained for anything are going to bump into the cancer more. And the CD4 killer cells are going to make memory against the cancer, which they may have not done before. So, yeah, I think all of those things, again, it does what it does. It's not magic, doesn't do everything. But as something that would help you in the background, there's not many things that do that good of a job.
So then what is one to do, right? So you have a patient with advanced prostate cancer. And so my 4 core pillars are diet, exercise, restorative sleep, and targeted supplementation. So that's what we start to create this microenvironment around the tumor. And then it's like, what is that 5th and 6th thing? Because the patient is going online and he's saying, well, I heard ozone is what, maybe I should do ozone.
Yeah.
And they're asking, right? Cold plunge, hyperbaric
Right.
oxygen therapy. So there's a lot of things like IV vitamin C. So, and sometimes it's just difficult for people to get IV vitamin C, right? So, right, there's no very little access. It's not like you just have you could have a cold plunge in your house if you want, or you could have a little sauna there as well. But IV vitamin C is different.
Yeah.
So how can a patient best make sense of this information and say, okay, you know what? Advanced prostate cancer, maybe I should go out of my way and go to Kansas or wherever they have a clinic and get it done there. The other thing is they're going to do it there temporarily because they live somewhere else, right? So is there any value there? Or should they go somewhere and say, okay, I'll do 20 treatments, and if that doesn't work, how can one make a decision as to what is that next thing to do?
Yeah, I think in trying to stratify what are you going to do, because there's, especially with the internet, there's a million things that sound good. No one can even do 20
coffee
things,
enemas.
Usually.
I mean,
yeah. So I have a little picture that's very similar to yours, where there's the base, of moving your muscles and sleep and eating and all those things. And then in the middle of the little structure on the foundation, I have your more common, say, botanicals you might take orally, things you pretty easily. And then the roof part is what I call the cool things that you may or may not have access to and often are expensive. So that could be IV vitamin C, IV ozone, all these interventional things, right? And those are great if you can get to them, but there are many people that just, you live in an area where you can't get to those things. So then you have kind of the things in the middle, which you could learn how to use or get and often do at your house. So the heat therapies, so a far infrared sauna is in the category of hyperthermia. Now, hyperthermia that's medicalized is hotter and it does different things and all that. But again, unless you're near a hospital that does that or you're in a research program that does it, you can't get that kind of hyperthermia. But you can get benefit, and I've done a fair amount of research into this for patients, from a standalone far infrared sauna that's got good generators in it that you could use at your house. It's at your house, and if you're moderately able to remember to do it, you're going to be able to do it, maybe 3 times a week, maybe less. And the thing with that, so just as an example at home, it's not only going to raise the temperature of your core, which again stimulates all these immune cells and the immune signaling and all that. It also is going to help your body get rid of junk. It helps on the detoxifying end of things quite a bit.
You get a lot of bang for your buck, and
there's a
right?
lot of
there's stimulatory elements to it as it relates to the immune system, if I'm not mistaken, as well.
Yeah. Oh, yeah. And it, without going too far down the road, one of the reasons that a lot of people in the cancer world will say, well, sauna's not going to do that much. It's not because that's true. It's because they're coming from the point of view of, say, a hospital-based 104.5 degree hyperthermia where we sedate you and do that, or a local regional that's blasting a lot of power through your prostate or through whatever organ we're interested in. And so they'll say, well, sauna can't, well, it's apples and oranges. When you have a decent far infrared sauna, it raises your core enough, and this is in the literature, to change the signaling cytokines that help your immune system to fight cancer, fight infections, do all the things. It definitely increases the elimination of toxic material out of your body. And then again, your normal cells are going to get this stimulation to them in a similar way to using your muscles, where you get those nice signals that go out that are very healing. Some of those same things get triggered by sauna level hyperthermia. So yeah, it's simple. You do want to talk to your healthcare provider about your tolerance for heat if you have any, blood pressure issues, et cetera. But It's easy to do at home. It's easy to start low and work your time up, stay hydrated, and you get a lot out of it. And like you said, you can fill your bath with cold water and plunge after if you want to, that sort of thing. So yeah, that's like an easy, high value thing.
Yeah.
Now that it's a little more available in the home unit world, I also have people get hyperbaric low pressure chambers. And again, the real old thinking was, oh, hyperbaric will spread your cancer. That's actually not true. Some people still believe that, but there's no data to show that. Hyperbaric, like heat, but this is now pressure and oxygen, triggers other immune stimulating anti-cancer pathways, et cetera. It does a lot of really cool things in that respect. So if someone has the ability to get a hyperbaric chamber, they can train you how to use them, and they have remotes and all sorts of stuff, so you can use them at home. So those are two things. I think if you only had time, space, and money for one, a far infrared sauna would be the first thing.
I am so happy you're saying that, because I've been practicing for 20 years, and I think you've been practicing for a little longer than that. So you've been in the game longer. You've researched a whole lot more, and you have a wider perspective of all kinds of cancers. And to me, that just made sense. If there's that next thing, and that's what I've been recommending as of late, there's that next thing. I think it be, and then there was very little friction to get, unless it could be monetary. Yeah. They're not cheap, but you could have it in your house and use it as often as you want, as opposed to IV vitamin C, which is definitely a plausible approach, but there's limitations to that. That's fabulous. All right. Well, Dr. Paul Anderson, you got to tell people about your YouTube channel, because my man, you're just crushing it. And the amount of information that you put out there, the quality of information in a world where there's just so much junk out there is really, really high. So tell us about you. Tell us about how can people find you and your work and your YouTube channel. And of course, if you have any final words.
Yeah. Well, thank you. We do work hard on the YouTube. It's a patient education platform, and there's a lot of information, and there's more all the time. For the public, that's probably the easiest way to find me. The YouTube is just called DRA, Dr. A Online. That's the YouTube name. Because I have other things I do, like books and other stuff, I have a hub website, which is dranow.com, just dranow.com. And it's got links to everything. But yeah, the YouTube we're over 100,000 subscribers, and we get a lot of views. And we talk about these sort of things. My whole practice pretty much has been either cancer or chronic illness. And those are the things I talk about.
No easy cases, your whole practice.
No, they get worse or harder. As time goes on.
You don't get any stage ones coming your way, stage 1, stage 2 cancers. No, you get
not a single one.
Right.
Yeah, no. So
any final words as it relates to integrative oncology, vitamin C, or anything that you want to share with the audience?
Yeah, I just think, like, to our last point, really, we can all do what we can do, what we have time and resources, but also proximity to. So if you're near 10 clinics that do all these different things, get one, provider to help be kind of captain of the ship and work with you to stratify what you can do. If you live very far away from any resources, they're still beyond our base of moving your body and eating clean and all the good things. There's things like sauna you could incorporate. There's other things that you can incorporate at home, like botanicals and all things. And don't feel bad if you can't get access to all of the cool things, because you can move the needle a lot by being kind of focused. And I think that's really important, not to be demoralized by lack of access, because there's so many things we can do.
A great point. Paul, thank you so much for being on.
Thanks, man.
Well, everyone, thank you once again for tuning in to this special episode around vitamin C and a little bit more as it relates to prostate cancer and advanced prostate cancer. We only get the best on the Dr. Geo Prostate Podcast. You know that. And so I appreciate you. I'm honored that you're here. Please subscribe, comment, and don't forget to go to the drgeo.com website. sign up for our newsletter. I give you different things all the time, depending on what I see clinically, some patient findings, things that are valuable for you to be a self-health advocate, right? That's what it's all about. So thanks again. Much love. And I'll see you next time. Dr. Geo here, signing off. Talk to you soon. If you love what you heard today, you can help by leaving a 5-star review of the podcast on Apple and Spotify, as each review helps us reach more men who are serious about improving their urological health and how to function better with age. And for the latest research and actionable takeaways in the world of men's health and integrative urology, sign up for my newsletter at drgeo.com. I'll see you next time.